Hey, hello everyone. Welcome back to my YouTube channel. So today I'm going to revise my topic, that is about the lichen planus. So in the lichen planus, we have to remember that what kind of lichen planus is a disease. So it is a chronic condition. So please remember that it is a chronic condition, and in this there is immune system is involving, like immune complex formation will be there. So it is a immune mediated. So it is a immune mediated, and here as it is a chronic condition, and when the immune system is involving, means there is overall inflammation is there. So it is a immune mediated inflammatory skin disease. Inflammatory skin disease. So please remember that it is a chronic condition. It is a chronic immune mediated inflammatory skin disease. So lichen planus, this is the definition, that it is a chronic immune mediated inflammatory skin disease. Now we also have to learn that what are the triggers of the triggers, or we can say why the immune system, immune complex formation will be there, why the lichen planus will occur. So the triggers were like, it is maybe due to the dental amalgam. Due to dental amalgam, it is the trigger. Dental amalgams, or we can say mercury, due to mercury, due to hepatitis C virus, hepatitis B virus, due to anti-malarial drugs. So all these were the triggers of lichen planus. And also here we have to remember that direct question will come, like this is a patient, he has a dental amalgam problem and he is having these kinds of rashes on his body. So we have to identify that a dental amalgam, it is a trigger factor for the lichen planus. So it is a chronic immune mediated disease, inflammatory skin disease. So these were the triggers. Now let's move, what are the clinical symptoms the patient will present to you. So in the clinical symptoms, like we have for this, that is the 6 P's disease. We have 6 P's. So it is also known as 6 P's disease. So what involves in the 6 P's disease? We have 6 type of rashes, or we can say 6 P involvement is there. So in first 1 P, that the lesion is in the purple color. Lesion is in the purple color. The lesion is either be the plaque or the papules. Plaque, papules. There is very much inflammation, means itchy area is there. That's why it is pruritus. Pruritus will be there. It occurs on the plain area. That's why it is lichen planus, as lichen on the plain area. Planus means plain area. So it occurs on the plain area, plain topped area, and it has various shape. So it is polygonal. It has various shapes. So these 6 P's for the lichen planus: purple color, plaque, papules. If it is less than 1 centimeter, more than 1 centimeter, but now it's get like 0.5 centimeter or more than 0.5 centimeter. If it is itchy, like pruritus, or occurs on the plain surface, and the polygonal in shapes. So these were the 6 P's. Now when it occurs on the surface, the lichen LP lesions will be there, and which appear. So here on the surface of lichen planus lesion, we can easily see a reticulate lacy white pattern is there, and which pattern is known as the Wickham's stripe. That pattern is known as Wickham's stripe. Please remember. Oh. So on the surface, as we can see here, this is a white pattern is on the surface of the hand. That pattern is known as Wickham's pattern. That is Wickham's stripe. Wickham's stripe. That is a reticulate lacy white pattern. That is a reticulate lacy white pattern. So this is the lesion, and it is mostly the lichen planus will occur on the flexner aspect of our body. So on the flexner aspect, please remember, it occurs on the flexner sides, like distribution is flexner. So distribution is flexner side. Now we have like more about that in this there is a like true Koebner's phenomena will going on, and there is no excoriation marks will be there, and when it going to heal, it heal with hyperpigmented. So these marks will heal with hyperpigmented. This is the most important point we have to remember, that this heal with hyperpigmentation. So hyperpigmented skin can be seen, hyperpigmentation will be there. Now in this we have some oral changes, and in the oral changes what we can find. So in oral changes what we find a reticulate lacy white pattern as similar as on the skin we are finding, but here it is when like it is reticulate white lacy pattern. So when we find this pattern, it can be a pre-malignant condition also. So we have to like much more careful about it, that in the oral if we find a reticulate lacy white pattern, so it can be a precancerous condition. So I will show you image for. So as you see here that these white striae as we are seeing, so all these were the oral changes which we find in the lichen planus. So in the lichen planus the mostly is the hair changes we can find, and we find also the nail changes. So for the nail changes or for the hair changes, first I am going to tell you about the hair changes. In hair changes we find that there is some alopecia will be there, and also the lichen planopilaris we also find. So in alopecia we find a scarring alopecia we found, and in the colors we find lichen planopilaris like perifollicular blue gray hue, perifollicular blue gray hue we find, and it is if the lichen planus is involving the hair follicular, then we can call that condition lichen planopilaris. Please remember, if lichen planus involve hair follicle, if it involve the hair follicle, we call that condition lichen planopilaris. Lichen planopilaris. Please remember that lichen planopilaris if it involve the follicles of our hair. Now what were the nail findings we find? So first I will show you the image for the hair changes. So as you see in this image, we can see a scarring alopecia will be there, a scarring alopecia is there, and also we can see that there is a like blue gray hue will be there. So blue gray hue we can see. Hue. So this is a perifollicular blue gray hue. So these two were the findings for the hair. Now we will move to nail changes. So in the nail changes, the most common finding is that our nail become very thin. So there is thinning of nail. So there will be thinning of nail. So nail becomes thin. After thinning of the nail, we can also find a pterygium of the nail. Means suppose this is our nail. So this one is our nail. So our nail skin turn like this. Not the skin, the nail. It will is in this shape. So that will form a pterygium of the nail. So pterygium of nail will be there. Pterygium of nail will be there. And pterygium here it looks like a wing shaped fold. So it is a wing shaped fold. Wing shaped fold is there. And that extends from our proximal nail to the nail bed, and also we can also find the pump tent sign. So in the pup tent sign, pup tent sign usually look like this. So it looks like we are going some tent. So it is in this shape. So now I will show you the image for the nail. So as we see here that nail pterygium will be there, as we can easily see, and the nails become like very thin. So this is a nail pterygium finding which is found in the Lichen Planus, and this is the pup tent sign. As we can see, the nail is looking like this, so it is a pup tent sign. So when there is like excoriations and that's all going on, so if we found in the histopathology, so in the histopathology what findings we will find if we do the histopathology? So in histopathology findings, so I am in this whole video I am only telling you the most important point. Please learn them with me. So in the histopathology, suppose here is our stratum corneum. So this is our stratum corneum, this one is our stratum granulosum, and then there is stratum spinosum. So in the stratum corneum, first of all, there is hyperkeratosis will be there. So first is there hyperkeratosis, we will see the hyperkeratosis, thickening of the skin, thickening of the stratum corneum we will find. And also in the stratum granulosum we find these type of shape. This is a wedge shaped, so wedge shaped granulosa, wedge shape hypergranulation will be there. So it is a wedge shaped, so wedge shaped hypergranulosis will be seen, and also the hyperkeratosis or stratum corneum, thick stratum corneum we are going to see. So when we are seeing the wedge shaped hypergranulosum, that is the Wickham's striae, Now in this we also see the civate bodies. Please remember, we also see the civate bodies, or we can also say the colloid bodies. What are these civate bodies or colloid bodies? Actually there is the lymphocytosis will be there. So when the lymphocytosis will infiltration is in the stratum granulosum layer, then infiltration that leads to the civate bodies, that formation the civate bodies. So in this we see the civate bodies. Now after that we also have the basal cell degeneration will be there, like in which the band like lymphocytes is infiltrating. So that's why this is our stratum basalis. So this basal cell degeneration we will see. Why this is basal cell degeneration? Because these lymphocytes get infiltrated. So when these lymphocytes is infiltrated, that's why we see a wedge shaped here. So that is a maximum Joseph space, which is known as maximum Joseph space. And we see the rete ridges, or also we can say saw-toothed rete ridges. Saw-toothed rete ridges we will see. And in the histological finding, we see the basal cell degeneration, saw-toothed rete ridges, Joseph space, civate bodies, colloid bodies, wedge shape, which I already told you, and hyperkeratosis of skin will be there. Now let's look a histopathological image. As here two images will be there. First of all, please look at this. So this one is a rete ridges will be there. So this one is a rete ridges, and we can see that there is thickening of the stratum corneum. So stratum corneum thickening will be there, and also we can see the rete ridges. While in the next image, in this image, we can easily see that there is hypergranulosis. These granulosa cells, like there is hypergranulation will be there, and also there is the presence of a civate bodies. Civate bodies, because in these keratinocytes we can easily see the lymphocytes infiltration against the epidermis. So that's why we see the civate bodies. So please remember, civate bodies were the findings of the Lichen Planus, and rete ridges is found in the Lichen Planus. Basal cell degeneration is found in the Lichen Planus. So if the patient come like this, so what will you going, how you will treat that? So for the treatment, as we all know, if there is any kind of inflammation is going in our body, we have to give the corticosteroids. So for this patient also we are going to suggest the corticosteroids. So corticosteroids is given, either it is given oral or in the topical form. So corticosteroid is the treatment for the Lichen Planus. So that's all for the Lichen Planus. I hope you will get benefit from this video. Thank you. Bye bye guys.